Have you recently faced any problems with intercultural communication? Maybe you couldn't understand your Walmart cashier when he or she was checking out your groceries? Maybe you found it difficult to find your way around in a foreign country? Differences in language may be the largest barrier people face with intercultural communication, but it is just the beginning. Language is a barrier that could be considered as out of our control and can only be overcome by opening up our minds to the communication of other cultures. However, many barriers exist merely because of attitudes and are well within our control. One of these barriers is ethnocentrism, which is the belief that one's culture is superior to another's. This belief is usually expressed because that person doesn't understand or refuses to understand another's culture. For example, it is very common for Americans, and more specifically those here in Garrett County, to believe that everyone should speak English. Another one of these barriers is stereotyping. Stereotyping is an oversimplification of a culture that can be based on just one person or one experience. Many stereotypes exist because of a lack of interaction with these other cultures, making it easy for people to judge them. Prejudice is another belief that it prevents or leads to negative intercultural communication. This negative attitude towards another culture just because they are who they are usually lacks reason, but has a profound effect on communication. For instance, if someone in a college classroom chooses to move seats just because someone of a different color skin sat down next to them, this is prejudice. This negative attitude by that student prevents them from even communicating with the other student, with whom they could have had a lot in common. As I mentioned earlier, language poses the biggest problem for intercultural communication. Language is one expression of cultural background and identity, but it can prevent people from interacting on a common level. I recently visited the Dominican Republic, a Spanish-speaking country, and the different vernacular caused quite the struggle when it came to communicating. There were many instances, whether it be when we were out for dinner or looking for means of transportation, that we were unable to understand or communicate with the staff. I've been taking Spanish in high school for the past 3 years, and I've learned a lot, but I was still unable to translate 90% of what they were saying. I tried really hard to pick out different words and try to form a sentence, but many words have different meanings in Spanish depending on the context, so it was hard to know when I was understanding them correctly. The differences in language may have caused a lack of communication between us and the natives, but the differences in culture enriched our vacation experience overall. Even a bilingual individual could face problems with forms of communication specific to a culture, like slang. Professional translators as well could face problems in their careers because some words could be lost in translation, which could cause a phrase to have a whole different meaning. Verbal language isn't the only form of communication that could cause problems between cultures. Perception of something like body language is also a problem when it comes to communicating interculturally. Similar to slang, many cultures have different gestures that are specific to them, and these gestures may mean something different to another culture. This miscommunication can make a situation uncomfortable and lead to an unfavorable outcome. The cultural diversity of the United States is only expanding, so it is likely that many of you will either work for or work with someone of a different culture. You may even have your own business with employees of different cultures. While cultural diversity in the workplace can be a great way for new perspective, there are many problems that could present themselves, and it is important for you to understand these problems so that you can avoid them or move past them. It is very important for a boss to be able to communicate with his or her employees, whether it be to give instruction or ask for feedback, but many problems could arise to prevent this. It is equally important for employees to be able to communicate in the workplace. Problems with intercultural communication could hinder employees from working together, leading to a decline in work performance of these employees. These problems, which could also apply to communication between a boss and employees, could result from negative attitudes like ethnocentrism, prejudice, or stereotyping as previously discussed, or they could result from a lack of comprehension caused by different languages. Problems with employee communication could even influence how they interact with customers, which could come back unfavorably on both the employees and the business. These problems with intercultural communication in the workplace will affect me in a variety of ways as a healthcare professional. Not only could these problems arise with my coworkers, but also with my patients. Medical terminology is one thing that may cause problems for me in my career, because it may be interpreted with different meaning by those of a different culture. As provided by the Encyclopedia of Public Health, Test results come back positive in the medical field, meaning that whatever the lab was testing for was found. This could present a problem when a biopsy testing for cancer comes back positive. Someone of a different culture may misinterpret this terminology and assume everything is fine when it is the opposite. Explaining this, if not done well, could even lead to more confusion and misunderstanding. Another problem may occur when providing a patient with medical instructions, especially if there is a language barrier. These instructions could be crucial to their health, so it is important for them to be clear. Giving a patient medical instructions regarding a prescription could be even more important, but would be nearly impossible if a patient spoke another language. As a healthcare professional, it will be important for me to reach those that are in need, especially those that may be less apt to seek medical treatment. According to Stephen B. Thomas, minority populations may have a different understanding of medical care in the healthcare system. They may also downplay the necessity for treatment if they know they will face problems with communication if they go to, say, a hospital. This is a problem that presents itself even before communication takes place. In this situation, treatment is avoided because of the fear of complication. It will be important for me as a healthcare professional to reach these minorities and provide them with the care they deserve. I have mentioned many problems in my presentation that could arise when communicating with those of a different culture. However, no matter the problem, it is up to you to decide if those problems will hold you and others back.